32, a male, was playing basketball, felt a pop with acute onset of pain involving his heel. What is your diagnosis? It should be an Achilles tendon rupture. The incidence of Achilles tendon ruptures in men compared to women is 84%. So mostly men will tear their Achilles tendon. Most of them are between the ages of 30 and 40 years old. They're almost always playing basketball or having some sort of push off when they feel this pop. They look behind them to see who kicked them, and there's no one there. That's the story I always get. There are 2 tests that you can do clinically to see if there's an Achilles tendon rupture. The first one is the Thompson test, and I'm going to show you what that looks like. Now, this poor guy, I fixed his Achilles tendon in the past, so this is his prior scar. So this is when you squeeze the calf, you should see the foot plantar flex. So do you see his foot plantar flex? Now, this is the side with the injury, and I'm going to squeeze his calf and see how there's absolutely no motion of his foot on this side, where when I squeeze it, see how this foot moves. The second test that I like the best is I will run my finger down the Achilles tendon, and then it drops into a hole. So what you'll do is, if you look above, you'll see me run down this Achilles tendon, and there's no dropping into any holes here. And when I run down this Achilles tendon, I drop into the hole. So he's got an Achilles tendon rupture. You can treat Achilles tendon ruptures either non-surgically in a cast, or you can surgically fix them. There is a higher incidence of re-rupture if you treat them in a cast, and there's a much lower chance that they will regain their normal strength if you treat them in a cast. So for my active patients, they are almost all treated surgically. The ones that I will not treat surgically are patients who are obese with diabetes. They almost always get an infection. So that patient population goes into a cast.